Hi, my name is Samantha. I'm an F&P student. I'm going to be performing your head-to-toe assessment. Is that okay?
Yes.
What's your name and date of birth?
Morgan Watkins, December 13, 2000.
Do you know what city we're located in?
Corpus Christi,
Who's the president?
Donald Trump,
And what is today's date?
September 6, 2025.
Patient is alert and oriented. Posture is upright. She's wearing clothes appropriate to the weather, and she is well groomed. Do you have any problems with your recent or long-term memory?
No.
Now I'm going to go ahead and start with the physical portion of the exam. Is that okay?
Mm-hmm.
All right, I'm going to palpate your scalp. There are no masks, no lesions. Any pain?
No.
Hair is evenly distributed. Have you noticed any abnormal hair loss or anything like that?
No.
All right, I'm going to have you smile for me. Puff out your cheeks. Show me your teeth. Facial symmetry is intact, and that's testing cranial nerve number 7. I am going to go ahead and palpate around your face. Is that okay?
Mm-hmm.
All right. Feeling your masseter, as well as I'm going to feel for your TMJ. Go ahead and open. Close. Go side to side. All right. TMJ range of motion is intact. I'm going to do your sensory test as well. I'm going to take a cotton ball and rub it across your face. You tell me which side you feel it on.
My right side, my left side, my right side.
And that is testing cranial nerve number 5. I'm going to start and look at your eyes as well. Go ahead and take a look at me. Eyelashes are intact. There's no drainage, no redness, no swelling. Have you noticed any drainage, any trouble with your vision?
Mm-mm.
I'm gonna look into your eyes, okay? I'm gonna use this light here, and I'm going to take a look into your eyes. You're gonna look past my ear. So right now, I'm just looking for pupil reactivity. That is testing cranial nerves number 2 and 3. I'm gonna also go ahead and take a look into your eye, okay? And no pain when I do that?
No.
We're gonna test your cranial nerves number 3, 4, and 6 and check your extraocular muscles, okay? You're gonna follow my finger wherever it goes. I'm also testing convergence, and extraocular muscles are intact. Any pain when we do that?
No.
I am going to have you do the cover-uncover test. You're going to cover your left eye for me. No abnormal deviation or movement. Go ahead and cover your right. No abnormal movement or deviation there either. I'm going to also test your peripheral vision. Tell me when you can see my fingers. There. Now I'm going to move on to the nose. All right, you're going to look at me. I'm going to palpate your nose. Is that okay?
Mm-hmm.
Any tenderness?
No.
Any pain?
No.
Okay. I'm going to take a look to see if I see any discharge. Have you noticed any abnormal drainage? Any pain from your nose?
Mm-mm.
Okay. And sinuses? No pain?
No.
We're going to go ahead and open your mouth for me. I'm going to shine the light. Is that okay?
Mm-hmm.
Gums are pink, moist, teeth are intact, good dentation, and there are no cracks in the lip. Any pain with swallowing, trouble swallowing?
Mm-mm.
I'm going to palpate your throat, okay? Any pain with that?
No.
Go ahead and swallow for me. Checking for her thyroid, any abnormal nodules. Go ahead and stick out your tongue. Move it side to side. And that is testing for cranial nerve number 12. I'm going to use this tongue depressor. I'm going to stick it in your mouth. Go ahead and say ah, ah. Uvula is movable, and gag reflex is intact. That is testing cranial nerve number 9 and 10. I'm going to move on to the ears. I'm going to palpate your ears. Let me know if you feel any pain. Ears are symmetrical, no pain, no masses, no lesions, no cuts. I'm going to look externally. I do not see any redness. No redness. Have you had any trouble hearing?
No.
I'm going to take a look in your ears. Is that okay?
Mm-hmm.
Go ahead and look that way for me. I'm going to pull up and back and take a look at your ear. Eardrum is gray, no redness. And the same on this side as well. I am going to be performing the Weber's test, and that is when I put the tuning fork on top of your head and you tell me when the vibration stops, okay? I'm also going to be performing what we call the Rhines test. I'm going to place it on your bone and then on the side of the ear, and you tell me where you hear it most, okay?
On the side of the ear.
And I'm going to do the same to the other side.
On the side of the ear.
Okay. So air conduction is greater than bone conduction, and that's testing cranial nerve number 8. All right, I'm going to palpate the neck again. Any tenderness, any swelling?
No.
All right, I'm going to have you stand up for me, okay? I'm going to be performing what we call the whisper test. Can you go ahead and look towards the door? You're going to cover your right ear. I'm going to whisper a word, okay? Tell me if you can hear it. Apple pie.
Apple pie?
Go ahead and cover your left ear. Soccer ball.
Soccer ball?
All right. Was one louder than the other, or were they both about the same?
Both were equal.
Okay, now it's time to move on to the lymph nodes. All right. So I'm just gonna palpate. All right. I'm going pre-auricular, post-auricular, occipital, supraclavicular, posterior cervical, superior cervical. I'm going to do tonsillar, submandibular, submental, and supraclavicular. Any pain when I do that?
No.
Okay, I'm going to take a look at your neck. Go ahead and swallow for me. Trachea is midline. There is no deviation. Have you had any trouble swallowing foods, anything like that?
Mm-mm.
No? Okay. Now I'm going to go ahead and go through with the respiratory assessment. I'm going to take a look at her breathing. Her breathing is equal, unlabored, no accessory muscles. Have you had any history of asthma, any trouble breathing?
No.
Okay, so now I'm going to palpate, look for any abnormalities, any masses or lesions. And I'm going to do the same for the back as well. Do you notice any masses or lesions?
Mm-mm.
Any cuts, bruises, scrapes?
No.
And no trouble breathing, correct?
No.
All right. Can I have you stand one more time? I'm sorry. All right. Go ahead and take a deep breath for me. Deep breath one more time. All right, that is equal. Chest expansion is equal as well. While you're up, I'm going to also test for tactile firmitis. I'm going to place my hands on multiple points in your back, and you're going to say 99.
99, 99, 99, 99.
The vibrations are equal bilaterally, and I'm gonna go ahead and go through with the front as well.
99, 99, 99, 99.
All right, equal on that side as well. Now I'm going to also palpate. And palpate the anterior chest as well. Sounds are equal bilaterally. Now I'm going to go ahead and auscultate. You can go ahead and take a seat. I'll do your anterior chest first, and then your back, okay? Deep breath in. 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 And I'm going to go ahead and test your back as well, okay? Deep breath in. 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 And deep breath in. Now I'm gonna go through with the cardiovascular assessment. All right, I'm gonna locate the PMI, which is on the left fifth intercostal space. All right, I can feel it. I'm gonna have you lay down and then look to the side for me. I'm assessing for jugular vein distension, any abnormal pulsation. Can you look to this side? And I see no abnormal pulsation on both sides, and that is a normal result. Can you go ahead and sit up for me? Okay, I'm going to auscultate. Listen to your heart, okay? I'm going to listen to her 5 points. Her aortic, pulmonic, Erb's point, tricuspid, and mitral. No abnormal sounds, no murmurs. Now I'm gonna go ahead and start with my pulses. I'm gonna check your carotid pulse. Good. Strong, equal bilateral. I'm going to also auscultate for bruits. I'm going to use the bell of my stethoscope to take a listen, okay? I'm going to go ahead and also go through on this side. Good. I'm going to go through with the pulses. I'm going to test for the brachial. Strong and equal bilaterally. Radial. Strong, equal bilaterally. I would also do the femoral. Strong, equal bilateral. popliteal, dorsalis pedis, and posterior tibial. Any pain or tenderness when I touch those areas? No pain, and you've had no problem moving anything? All right. One more time. All right. Now I'm going to go ahead and have you lay back. I'm going to perform the abdomen assessment, okay? Can you lay back and scoot a little towards me? Thank you so much. I'm going to move some of these items. All right. I'm going to expose your belly a little bit. Is that okay?
Mm-hmm.
All right. My hands are a little cold. I'm sorry. All right. So I am going to start off with auscultation. I'm also taking a look at her abdomen. There are no scars, no lesions. Have you had any pain?
Mm-mm.
No pain? Any trouble with bowel movements? Any diarrhea? Constipation?
No.
Okay, now I'm going to go ahead and go through with auscultation. I'm going to go in a clockwise motion. Okay, I'm also going to auscultate for any bruise, okay? So I'm going to use my stethoscope again. I'm going to listen to the aortic. The renal. The inguinal. No bruits are present and bowel sounds are active. Now I am going to go through with percussion. And I'm also going to palpate for the spleen. And for the liver. Now I'm going to be performing palpation. I'm going to do light first and then deep, okay? Let me know if you feel any pain. So I'm going light. Any pain?
No.
I'm going to go harder, okay? I'm going to check for Murphy's sign. Any pain when I press here?
Mm-mm.
And it's negative. And I'm also going to check for rebound pain. Let me know if you feel pain when I let go.
No pain.
No pain. All right. Can you lift your legs to your belly? And go ahead and do the same with the other leg. Okay. Any pain with that?
No.
All right. You can go ahead and sit up for me. I'm going to move on to the skin assessment. All right. Skin is warm throughout. Have you noticed any cuts, any abnormal bruising?
No.
Any pain when I touch any of those areas?
No.
All right, I'm also going to check for skin turgor. Good. Good recoil on both hands. Hydration is good. I'm going to also check cap refills on your fingers. Cap refills less than 3 seconds on her fingers. And I'm going to check her toes. Cap refills intact as well. Any pain, any abnormal sensation when I do that?
No.
Okay, now I'm gonna go ahead and go through with the reflex test. Okay, so I'm gonna be hitting various areas and you let me know if you feel any pain, any abnormal sensation, okay?
Okay.
So I'm gonna start off with the bicep. Okay. And as well as the tricep. Okay, so I'm gonna lean your hand over my hand here, and I'm going to do the brachioradialis. Any pain, any sensations? Okay. I'm also going to do the patella, the Achilles, and all reflexes are intact. Any pain, any abnormal sensation? Now I'm gonna go ahead and go through with the musculoskeletal, okay? So I'm gonna have you perform a couple of range of motion exercises. Is that okay?
Mm-hmm.
All right. So you're gonna look at me straight. I'm gonna have you look left. Can you look right? Look up. Look down. And we're also gonna test against resistance, okay? I'm gonna push resistance and you're gonna look to the left. All right, go ahead and do the same for that side. And that is testing cranial nerve number 11. I'm also gonna do your shoulders. So I'm gonna palpate your shoulders. Go ahead and shrug for me. Strength is equal bilateral. Go ahead and roll your shoulders for me. Roll them out. Pick up your arms straight as you can and bring them back down. Can you roll your shoulders for me? Good. Any pain? Any previous shoulder injuries? Anything like that?
No.
Okay. Now I'm going to also perform the range of motion on the waist. Can you stand up for me? Can you rotate side to side? Good. Any pain? Any abnormal movement?
No.
All right. Now I'm going to do the wrist range of motion. Can you swing them in a circle? Any pain? Any abnormal movement that you feel? And now we're going to test for grip strength, okay? So grab my fingers, squeeze them as hard as you can. Strength is 5 out of 5 bilaterally. Can you go ahead and take a seat? I'm going to test the range of motion of your knee. Go ahead and lift your legs up. Good. Do the other side. And now can you turn them in and out? Perfect. Any pain?
Mm-mm.
I'm going to palpate for crepitus. Any pain when I do that?
No.
Now I'm going to have you do a little bit of walking for me. Can you go ahead and stand up? I'm going to have you turn side to side and I'm checking your spinal range of motion, okay? Any pain, any abnormal movement?
No.
Go ahead and bend down. I'm also going to test and feel for her spine. Make sure it's midline, there's no abnormal deviation or abnormal curve. No. All right, can you go ahead and bend back for me? All right, I'm going to assess her upper extremity strength. So now I'm going to have you put your arm and go ahead and push for me. All right. Go ahead and push. Thank you. Can you go ahead and take a couple of steps that way and a couple of steps back, okay? Posture is up straight. Any pain with movement, and gait is steady. Now we're going to have you do the heel to shin test. You're gonna raise your heel and put it to your shin. Good, balance is steady. Go ahead and do the other side. Now I'm going to test her fine motor skills. Can you go ahead and pinch the tip? Okay, go ahead and pinch the tip with your other hand. And that was testing your fine motor skills. And now I'm going to have you jump. And that is testing your gross motor skills. Okay, go ahead and take a seat for me. I'm going to test your sensation. I'm going to test your sensation throughout your body, okay? And you let me know if you'll feel either dull or soft, or sharp, okay? All right. Close your eyes.
Dull. Sharp. Dull. Sharp.
All right, and sensations intact. Well, that concludes our head to toe assessment. Do you have any questions, any concerns that you want to bring up for me?
No.
All right. Thank you so much.